Most ankle sprains occur as a result of ankle joint inversion where the foot rolls inwards. Thereby, the most frequently injured ligaments are the anterior talofibular ligament, the ATF, and the calcaneofibular ligament, the CF. So most, but not all, of the ankle taping that we do is meant to address lateral ankle instability. For best results, we will anchor several strips of tape directly to the skin. If the patient needs all of the tape on the pre-wrap, you can do that too. But regardless of your choice, the top anchor should approach the base of the belly of the gastrocnemius. Remember to angle the first strips to conform well to the cone-like shape of the calf. The distal anchor at the foot can be entirely on the pre-wrap. Once the anchors are set, what we will call the first functional strips applied will be the stirrups. Stirrups will be pulled from the medial side of the leg to the lateral anchor. After each stirrup is applied, a circular strip will be applied to tack down the stirrup. This sequence will be repeated 3 times. These alternating strips are sometimes referred to as a basket weave technique. The purpose of the stirrup is to control the calcaneus. Try to land your stirrups as close to the center of the calcaneus as possible for greatest comfort. Once the third stirrup and circular have been applied, continue covering the remainder of the Achilles. Sometimes these strips are called horseshoes, as they go from anchor to anchor but don't really circle back to themselves. Once the Achilles is covered, Kelsey covers any remaining holes, with the exception of the apex of the calcaneus, which can remain uncovered. Now that the entire ankle has a good base layer, the next functional strip to be applied is the figure 8. The direction of pull is, again, medial to lateral. The figure 8 loops around the foot, shoring up the lateral foot before encircling the low leg. Generally, 2 figure 8s are used in the basic taping. Extra videos are available that detail the figure 8 application. The last functional strip is the heel lock. You will want to watch the extra videos available on heel locks as well. They begin on the dorsal aspect of the foot and clip the calcaneus at a 45-degree angle before returning to the top of the foot. Kelsey is first demonstrating the continuous heel lock, which places one lock on each side of the ankle without tearing the tape. Then she puts the last 2 heel locks on one at a time. Either way is perfectly acceptable. Heel locks are applied 2 to each side, and the order doesn't really matter all that much. She finishes the tape job with closure strips. These ensure that all of the various tape ends are covered and any areas of unequal tension are mitigated. By closing from top to bottom, the athletes will be able to easily apply their sock over this secure and tidy tape job.